So now we're going to have a look at how to carry out the hand hygiene technique. It takes approximately 30 seconds to do. So first of all, to point out that it's very important that we are BBE, bare below the elbows, unless you are wearing a long-sleeved gown in relation to caring for a resident with COVID-19. So when we talk about bare below the elbows, that also includes jewellery should be removed, no false nails and no nail varnish. If you are wearing a wedding band, it's very important that you slide up that wedding band and clean well underneath and then put it back into place. So the actual technique itself that takes approximately 30 seconds is the exact same whether you're using soap and water at the sink or whether you're using alcohol rubber gel. So if you are going to the sink, always make sure that you wet your hands thoroughly first. So turn on the tap and wet your hands. Then you use a small amount of the soap, approximately 5 mils, depending on the manufacturer's guidance. So that will be 1 to 2 pumps. And then you will do your hand hygiene technique that we'll do in a moment. Make sure then that you rinse your hands thoroughly. If you have elbow operated taps, then you would use your elbow to turn off the tap. If you don't have elbow operated taps, then leave the tap running. Take disposable paper towel and dry your hands thoroughly. Start at the fingertips and work your way down to the wrists. Again, if you're wearing a wedding band, make sure that you lift up that band and you dry thoroughly underneath. Make sure you're also drying in between the fingers and the tips of the fingers. Organisms do like a nice, warm, moist environment, so dry your hands correctly. Once you have finished drying your hands, the paper towel that you've just used, you can then use to turn off the taps. And then you dispose of that paper towel into the waste bin. And making sure that you do not touch the bin. It should be a pedal operated bin. In the event that the pedal is broken or it's not pedal operated, it's important that you would also use the disposable paper towel to open the bin and put the disposable towel in. So avoid touching the bin. Okay, so the technique itself. If we are putting alcohol rubber gel in our hand, or we're using soap from the dispenser, it's always important to use the heel of your hand. So we pump the dispenser with the heel of our hand. If we have a freestanding bottle, we also use the heel of our hand to pump. So avoid pumping with tips of fingers. So once we have put the solution onto our hands, the first thing we do with our hands, fingers closed, we rub our hands together 5 times. Once we've carried out that, with our fingers still closed, we rub the backs of our hands 5 times. So you need the back of both hands. Once we've done that, we open the fingers and we again rub the backs of the hands, making sure that we're getting in between the fingers and the other side. We're doing that 5 times. Bringing our hands back together, and again we're going to rub 5 times, making sure we're getting in between the fingers. We then bring our hands together and we're going to rub 5 times to clean the tips of the fingers. Now we're going to clean the palms of the hands as well as focusing again on tips of fingers 5 times, and the other side 5 times. Now we're moving to thumbs. So 5 times on each side. And finally our wrists. 5 times. So the technique itself, the steps are step 1, step 2, step 3, step 4, 5, 6, 7, and 8. So we have 8 steps in total. So we're going to do it again, but this time you're going to do it with me. So hands together and rub, fingers closed 5 times. 1, 2, 3, 4, 5. Backs of hands, fingers still closed. 2, 3, 4, 5. And 1, 2, 3, 4, 5. Fingers open. 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. Back together. 1, 2, 3, 4, 5. Tips of fingers. 1, 2, 3, 4, 5. Palms of hands. 2, 3, 4, 5. And 1, 2, 3, 4, 5. Thumbs. 2, 3, 4, 5. 1, 2, 3, 4, 5. And wrists. 2, 3, 4, 5. And 1, 2, 3, 4, 5. Okay, we're going to do it once more, but this time we're going to speed up a little bit. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And 1, 2, 3, 4, 5. And again, bit faster again. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2, 3, 4, 5. And 1, 2, 3, 4, 5. And I think we'll have one more go. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2, 3, 4, 5. And 1, 2, 3, 4, 5. So now I hope you're very, very comfortable with doing your hand hygiene technique effectively. Takes approximately 30 seconds. If in doubt, clean your hands. It is the most effective way that we can reduce the spread of infection at the means of transmission. Clean your hands.